This episode of the Caregiver Community is sponsored by Pace at Home. During this uncertain time, Pace at Home is enrolling participants who wish to continue to remain at home. Partnering with families, Pace at Home provides caring medical support for all of our program's participants. Visit us on our website or give us a call at 828-468-3980 to talk with a representative that can discuss with you the Pace at Home all-inclusive medical approach. Pace at Home is the champion for seniors wishing to remain in their community.
Welcome to the Caregiver Community. This is a place where we talk about the joys and the challenges of caring for our aging parents and loved ones, as well as caring for ourselves. I am Frances Hall, founder and executive director of ACAP, Adult Children of Aging Parents. In this podcast, we are talking about oral health, aging, and caregiving. I am delighted to be joined by Dr. Natalie Whitaker, a dentist and a nutritionist. Dr. Whitaker graduated in 2004 from UNC, that's University of North Carolina, Chapel Hill School of Dentistry, and has worked in private practice since then. Prompted by her own health issues, she also obtained a master's in nutrition degree in 2012, which propelled her into the world of all things health and wellness. She currently lives with her family in Morganton, North Carolina, and enjoys private practice, which allows her to engage with people in all walks of life and at all stages of life. Dr. Whitaker, thank you so much for being with us today to talk about such an important topic. Thank you.
Well, thank you for having me.
Absolutely. This is a topic that we've wanted to talk about for a while. So I'm really glad that we're going to do this. There is a whole lot that we could talk about. No question about that. I think that most of us really don't understand how really important oral health is and dental care is, particularly as we get older. So let me kind of start with the basics. What are some of the biggest challenges with oral health as we age?
One of the biggest challenges that I see on a daily basis, and it primarily is as people age, is dry mouth. And it's such a debilitating thing for people to have to experience. A lot of times it comes from just necessary medications. You know, like if you look at the side effects of any medication that you're taking, usually one of the top 3 things is dry mouth. And then if you layer 3 or 4 different kinds of medications on top of each other, it's only going to compound the issue. So that's one of the issues that I see. Also, like low-grade dehydration, because as we age, our thirst response naturally decreases. So not only do we have a dry mouth, we don't have enough water in our system to fuel our salivary glands. And if they're already at a diminished capacity, it's just kind of a perfect storm for issues. Another thing that I see a lot of times is because of that dryness, we'll have sores, like burning mouth syndrome. Sometimes there'll be ulcers that creep up, things like that are just painful, and they take a little bit longer to heal because of the diminished capacity to heal as we age, and that's frustrating for people and myself. I mean, I really don't want people to be in pain. Then periodontal disease is something that I see, and that's where essentially the bone kind of melts away from the teeth, and then it just makes the teeth longer, and longer teeth in the mouth make them more susceptible to decay. So that's another issue that we have to kind of take into consideration. Another challenge is manual dexterity. So there's decreased manual dexterity as some people age, whether it's because of arthritis or what other reasons for that. And, when you can't properly clean your teeth with the tools that you have because your hands don't work the way that they need to, that's a significant challenge.
Some of those I really understand, but go back to the very first one, dry mouth. I mean, besides just that being maybe sometimes uncomfortable. What's the real issue with dry mouth?
Well, the consequences of dry mouth. So the bacterial composition in the mouth can change, and that can like make you more susceptible to decay. So saliva is incredibly important for a couple of things, or a couple of reasons. One, it has an enzyme in it that starts your digestive process. So you need that enzyme to properly start carbohydrate metabolism. So there's that. Saliva also lubricates the tissues in your mouth, so that's important. But it also buffers any kind of acidic exposure that you have. And with increased acidity, you have an increased risk of cavities. So, and then we know cavities can lead to infections, and then infections on and on and on. So that's why saliva is critically important. Adequate saliva is critically important for oral health.
And saliva is directly related to water or fluid intake.
Yeah, it can be. I mean, absolutely. I mean, it's just like if your lips are chapped, or if your lips are dry, that's like a secondary sign of dehydration, like low grade dehydration. So it's the same thing with your skin. Like if your skin is dry, then you need to increase your water intake. And plain water is important. I know we look at, like flavor additives and things like that. And that's okay if that's the only way you can get water in your system. But if you can focus on a little bit more plain water throughout the day, then that can only help increase your ability to produce saliva.
Okay, so as a daughter of a mother who thought literally if she drank 4 ounces of water in a day, that she was just like knocking it out of the ballpark. Do you have any suggestions? Because a sort of a universal issue for those of us who are caring for, advocating for an older adult, one of the universal issues is trying to get people to drink, trying to get our loved one to drink water, particularly, the thing of, oh, I didn't grow up drinking water, I'm fine. Do you have any suggestions as to how to get people to drink water in particular?
That's a hard one because in my mind, it's easy. You just drink the water. So, but
I know, me
realized,
too.
but I hit roadblocks all the time. People are like, well, I don't like water. And in the back of my mind, I'm like, how do you not like water? But I get it. When we're in a world of super sweet and caffeinated everything, water's not a priority. So like I said, I'm not necessarily a proponent of those like squeeze in things that you add to water to give it flavor because they've got all these other chemicals. But if that's the only way that you can get people to drink any kind of water, then by all means do that. I'd rather do that than not drink anything or drink like caffeinated beverages, like more coffee or things like that, because the caffeine has a natural dehydration effect as well. So, instead of those kinds of things, if you can't just drink plain water, whatever you can put in it, if it needs to be a little bit of lemon juice, just to give it the flavor that you need, that's great. I would just caution that it's not lemonade because you've got the issues with the sugar in there. So, and that is just counterproductive in the whole scheme of things. But yeah, I mean, if you can't just do plain water and measure it, because you're right, 4 ounces, somebody will drink a tiny little bottle of water and think that 4 ounces, they have drank water all day long. Because my grandmother is one to do that. You actually kind of have to measure it. And they have wonderful, measuring bottles that like will help you track drinking it throughout the day. Like you should have this much done by, noon and this much done by 1 p.m. and that kind of thing, which are wonderful tools for people.
That's a good idea to let them drink out of a cup or a a container that has some measurements and some guidelines on it, because I think sometimes they really don't understand. I mean, there is that whole thing of, oh, but I don't need water. I'm not thirsty. I don't need to drink that much water. But to be able to, possibly sometimes they really think that they have drunk more than they have.
Yeah. Well, and the natural thirst response decreases with age, like I said before. So you're just really not as thirsty, but there'll be signs like dry lips, dry skin, those kinds of things or dry mouth, that you need more fluid. And honestly, the more fluid that you have, the more water that you have in your system, your medications are going to work better. They're going to get to the places that they need to better. You're going to be able to digest your food better. You're going to be less likely to have things like constipation, because, that's where you use a lot of water to digest and eliminate waste from your body. You'll have less likely UTIs, which are terribly devastating for older people, and terribly painful. So, those are some of the other reasons that, just trying to focus a little bit more on water intake is important.
Right. Yeah. Yeah. As you kind of listed all those reasons, of going, check. Yep. We did that one. Yep. Check. We dealt with that one. Yep. Check.
Mm-hmm.
Yeah.
Yeah. It's one of those low hanging fruit things, it doesn't take a whole lot of effort. Although some people feel like it takes a lot of effort, it doesn't have to take a lot of effort to do something that would have a very, very important impact on a lot of facets of life.
Right. But I just wanted to sort of go a little deeper into that water.
Sure. Yeah.
Okay. So you kind of talked about the UTIs and some of the issues issues that can happen from not drinking. And you also said something about dry mouth can cause cavities, which can cause or can become infections and all that sort of thing. Talk about oral health and how oral health can affect our overall health, or vice versa, how our overall health can affect our oral health.
Yeah, well, I think in medicine today, we're really big on separating systems. You have subspecialties for all different kinds of things. You've got the kidney doctor, you've got the digestive doctor, the brain doctor, all of this stuff. But in reality, it's all connected. We're all connected. So taking a bigger view of that, any kind of risk of infection, whether it be in your mouth or whether it's your leg or anywhere, has that problem of ramping up the immune system. And then, when the immune system ramps up, you feel bad, you can't function, you can't eat, you can't drink, then you can't, operate as optimally as you want to. So, infection is kind of an obvious thing as far as that goes. If you have dental infection, the next closest organ is your brain. There can be deadly consequences for oral infections as well, but not so much infections. That's kind of an obvious one. It's the underlying increase of inflammation, just low grade chronic inflammation from having troubles with your mouth is what really impacts all the systems of the body. That inflammation can result in cardiovascular disease, which, is strokes, heart attacks, those kinds of things. It can also result in thyroid issues, digestive issues, even like Alzheimer's and dementia can be related to low-grade inflammation. If you have infections or inflammation and you are a diabetic, it can make your blood sugars go into a tailspin, and then that only leads to more inflammation. So it's a vicious cycle of inflammatory factors. If you start out with a cavity that leads to an infection, or gingivitis that leads to inflammation, or periodontal disease that leads to inflammation, and this is just the start of the whole body where it can impact everything. And then like if you have autoimmune conditions, they can be presented in the mouth as well with ulcers and things like that. There's several different autoimmune conditions that are presented in there. You can have even like viral infections, like herpetic infections inside the mouth, like shingles inside the mouth. So like I said, we're all connected, and it can be anywhere and everywhere at any moment.
I wish you all could see my face because as I go through saying this, I'm like grimacing and just making these really awful faces, thinking, "Oh, shingles in the mouth," and some of these conditions. Oh my heavens! I have a friend who, I think I'm saying this right, that her mother had an oral infection. A tooth got abscessed. A tooth got infected, and it wound up damaging her heart because of the infection. And another friend, similar kind of situation, but her mother wound up with really severe knee issues, again because of the infection that I guess sort of traveled through the body, or the inflammation, and it wound up permanently. That both of the mothers wound up with permanent damage because of an oral infection, in essence, kind of started.
Yeah, and so to speak to both of those things, there are certain heart conditions like, maybe heart transplants or valve replacements and things like that, where you have to pre-medicate with oral antibiotics before you have dental work done because the bacteria in the mouth, especially if the oral home care is not as good. So that means the bacteria count is much higher. They can set up in those heart valves. They can set up in those artificial joints. Absolutely. So we do pre-medicate certain individuals that are more susceptible to those with antibiotics. And I know the usually if we're going to do that, then we get the clearance from their doctor or surgeon, because antibiotic usage has gotten wildly out of control and we're breeding these super bugs and things like that. But there's definitely a risk of any kind of bacteria setting up in the weakest link of your system, whether that's your heart, your knee, your brain, any part. There's definitely a risk of that.
But I remember again, my mother had mitral valve prolapse, a heart murmur, which seemed like, fairly innocuous. She had had it since she was a child, but every time she went to the dentist, even for just a regular cleaning, she had to take I think it was an antibiotic before they could do anything in terms of dental work. Yeah.
Yes.
Yeah.
Yeah. That is not one of the conditions. They are, fortunately, that we're constantly, as the American Dental Society, the American Heart Association, the orthopedic doctors, we're constantly updating that pre-medication requirements so that we don't overutilize antibiotics and cause these other problems, but yet also protect the people that need to be protected.
Oh, it's such a balancing act, isn't it? Mm-hmm. Everything is a balancing act. We just were sort of talking about teeth. Why are teeth important? I mean, we know a lot of people who, particularly as we age, lose teeth. And I know dentures can be difficult and all that sort of thing. But talk about why teeth are so important.
Well, I mean, just eating. Eating efficiently, not only is it one of the greatest pleasures of my life, it's a necessity for most people, is being able to eat efficiently. But chewing is the start of the digestive process. So, being able to chew your food well, then your stomach can do its job well, then your small intestine can, uptake the nutrients well, and then your body can utilize that more efficiently. So being able to chew well is just the whole start of the digestive cascade in order to get the appropriate fuel and nutrients that you need. Another reason why teeth are important is just for speaking and communicating. We use our teeth to make certain sounds and be able to speak, and forming words and communicating is vitally important as us being human beings. Another thing is facial shape and aesthetics. So, being able to communicate, by maintaining your facial shape and not having sunken in lips and things like that, it gives you confidence to be able to communicate with other people. We're very social creatures. It's very vital for our quality of life and our longevity to be able to interact with other humans. And, if you want to do that, you want to be as happy and confident and, look as good as you can. And that way we can have those social family interactions that you won't be, ashamed of, or whatever, issue that you may have to sequester yourself away from, society. So, I mean, those are just some of the big reasons why teeth are important.
Well, and I think probably all of us, or some of us anyway, particularly enjoy our food and would be really upset if we had difficulty really eating foods that we like.
Well, also, just to speak to that, you, in an ideal world, you want to eat foods with different textures, and you have to be able to chew them, because you want to stay away from like the ultra processed foods that are super easy to chew and digest, because they just are essentially like a sugar bomb to your body. But without teeth, those are the ones that people typically gravitate towards because they're easier to get in. But you want to be, and it takes more effort to boil carrots and mash them up than it is to just open up a pack of pudding, So it's a way to be able to get a variety of whole foods that are only going to increase nutrient intake.
And particularly as we age, our nutrition is so critical to healing if there is an injury, to longevity. It's just really critical that we have good
or even preparing for surgeries. So, for example, protein is one of the most important macronutrients that anybody can have, no matter what phase of life, because protein is the building blocks of, muscle tissue and collagen and, all of these things that heal wounds and give us the ability to produce energy to live an effective life. So yeah, and getting protein in, there's protein powders and things like that, but I mean, who doesn't want to eat a nice juicy steak, or, get in those protein requirements that way? That chewing with adequate dentition, you just can't overstate the importance of that.
And for those who are vegetarian or vegan.
Oh, exactly. Like if you're having to eat, you want to eat the quote unquote roughage. Like you want to be able to eat the salads and the, all the vegetables. Like you don't want them, because when you prepare them and cook them, then you lose some of their nutrients. So, sure, it's okay to boil potatoes and, things like that. But if you can eat the lettuce and the tomatoes and things like that with with chewing, as opposed to just mashing it up in your mouth and swallowing it, it's gonna be a more enjoyable situation anyway.
Right, more enjoyable, and begins, as you said at the beginning, it begins that whole process of digestion and getting the nutrition, rather than it's just sort of in and out kind of scenario. Yeah. Help us understand some things that aging adults or caregivers or both. What can we do to make sure that we have a healthy oral environment? What does that even mean?
Well,
what does healthy environment even mean?
So, a healthy oral environment is free of disease. So if we can be free of disease, then, that's obviously the optimal health. So to promote a healthy oral environment, get regular checkups, and get the films, get the x-rays that are needed. I have a lot of pushback on getting dental x-rays. And I understand there are various factors for that, fear of radiation. I mean, with the world we live in, cost, things like that. Or just a lot of people are like, I've had so many procedures done, I don't want to have another picture taken or anything like that. I totally understand where they're coming from. But it's like, I can't see what I can't see. And those films, give me an opportunity to see what's underneath the tissue, it's underneath the bone, to look for those latent infections that may not have any symptoms. Lots of conditions have no symptoms, but that doesn't mean they don't need to be addressed. And that's the same thing with dental films. Getting those, I can fix a small problem very easily, as opposed to reacting to a huge problem later, by being able to see with those dental films. Another simple way to increase your oral health and your oral environment is just brush your teeth. And I know like the recommendations are to brush your teeth twice a day, but I would recommend 3 times a day, because the longer food particles and things can stay in there, the more susceptible you are to cavities and infection and things like that. So just adding 1 extra brush in the middle of the day, it'll help you from having, your hygienist won't have to scrape on your teeth as much because there won't be as much tartar that is deposited on the teeth. And it'll just decrease that bacteria count in there. And then another easy way is, like we've said before, just minimize sugar intake. As we age, our tastes change, and a lot of times sweet is more enhanced, so you can taste more if it's sweet. And so that's why a lot of older individuals gravitate more to sweet things, because they can just taste it better. And that's, obviously not best for oral health or overall health.
Right. But yeah, we live in this society that we think it has to be sweet or really super salty. One or the other. One or the other. Go ahead.
Well, I was just gonna make a point about the, talking about the brushing and then the sugar and stuff, that, people may not know, it takes 4 things to form a cavity. It takes a tooth, it takes bacteria, which everybody has bacteria in their mouth. And some people have, a disparity between quote unquote good and bad bacteria that can make them more susceptible to decay. But everybody has bacteria in their mouth. Then the bacteria need a food source, which is typically that sugar or a simple carbohydrate. And then it needs time to work. So those 4 things: tooth, bacteria, food source, and time. So if you can disrupt any one of those 4 things or multiple things, then that's going to greatly decrease your propensity to form a cavity. So like with a tooth, teeth are in there, that's one thing. Bacteria, so that's why I recommend brushing 3 times a day instead of 2, because it gives the bacteria in your mouth less time to sit in there. Because say you get up at 7 and brush your teeth, and then you go to bed at 10, that's a really long time in between that those little bugs can fester in there. You're eating multiple times throughout that's getting all kinds of food sources. So that's why 3 times a day is better. Then with the food source, if you can decrease the amount of simple carbohydrates or sugars that the bacteria use, when the bacteria use it, they metabolize acid. And so that's kind of what happens. The teeth essentially melts and causes that cavitation in the enamel of the tooth. So then there's where it comes in time. So I'm not saying you have to give up sugar forever. You can still have your sugar, but it takes your mouth, with adequate saliva flow, it takes your mouth a minimum of 15 to 20 minutes to buffer that acidity that's formed from a sugar exposure and bacteria being in there. So people, if you have like sodas with the screw tops on there and you take a sip and 5 minutes later you take another sip, it's a constant sugar acid bath for your teeth. And that's what really gets people in trouble is sugary beverages, sipping on sugary beverages, sweet tea, lemonade, sodas, throughout the day. That's, if you can minimize those kinds of beverages to just meals specifically, then, water in between, you're going to greatly decrease your chances of cavities.
Okay, so no more Starbucks for me, huh?
You can have it, but don't sip on it all day.
There you go. There you go. Oh my goodness. That's really interesting. I had never heard it characterized quite like that in terms of cavities need four different substances to form. And I'm thinking again about caregivers who are listening to this and thinking, what are some things that they can do for their loved ones that would be really significantly helpful with a real, well, in some cases, a minimum of effort. And that is, here's a toothbrush and toothpaste, go for it.
Yeah. Yeah, caregivers, it's difficult, especially because each person has their own specific needs and abilities. Like with dementia patients, they may not, they have good days and bad days. They may be able to do things by themselves. They may not be able to. So, like with brushing the teeth, may have to literally watch them do it to make sure that it's done if they have the ability to do it. If they don't have the ability to do it themselves, then there are tools like electric toothbrushes are great. There's actually a double-headed electric toothbrush that you can get more surface area in. That works really well for like special needs children as well as aging adults. But really, it's monitoring them, kind of looking at their sugar intake or what they're eating, establishing routines around oral health care. Routines are incredibly beneficial for any human, but especially either dementia or, any human. And then, really, it's just you try to do the best you can do. I know that sounds so cliche, but it's like you just do the best you can do. As long as it's in your mind that it needs to happen in whatever capacity that it can happen, brushing the teeth, monitoring that, then it's going to be good, whatever capacity it can be done in.
Yeah, I really appreciate that affirmation that caregivers are doing the best they can do
Yes.
in so many difficult situations. So I want to give a shout out specifically to those who may be listening to this, who are caring for someone, regardless of what the situation is or what the circumstances are. So let me ask you this. I've known someone who had COPD and congestive heart failure. The person was in their 90s, and she literally did not have the strength to brush her teeth, although this is somebody who was diligent her entire life. Okay, so what about if the person is not able to brush and they're not willing for someone to brush for them or floss for them? What about using Listerine or some mouthwash kind of substance? Is that helpful at all?
Well, it has limited benefits because of the limited amount of time that it's in exposure with the oral cavity. So, Listerine is, if that's the only thing that you can use it. Or if that's the only thing that's tolerated, do it. Listerine is a little bit harsh because of the alcohol content. However, they do have some that don't have that alcohol in it. And it does kill bacteria. So absolutely, it's beneficial. Probably more so, I would recommend a fluoride rinse because that's going to buffer some of the acidity in the mouth and then help remineralize any kind of cavities that may be starting. So there's the big brand name of fluoride rinse is Act, but I know like they have Equate, like Walmart brands and off brands like that. So you don't have to pay for the brand name. But I would probably more recommend a fluoride rinse because it's not so harsh on the tissue. than the like the Listerine.
Good to know. Good to know.
Mm-hmm.
Thank you.
Mm-hmm.
You talked a minute ago about people with dementia, and that is such a difficult journey and such a challenge for so many adults and caregivers, family members, and loved ones. Are there do you have some particular suggestions as to how to work with a loved one with dementia? How can we best care for them relative to oral care?
Yeah, it's very. I'm learning how to deal or help service dementia patients now. So, I mean, you have to meet them where they are, and there are good days and there are bad days. And if it's a bad day, it's okay. It's okay to skip the day if you oral health care is important, but quality of relationship is more important. So it's okay to take a break if you have to take a break that day. Um, One thing is if they repeatedly complain about something that hurts or a sharpness or something like that, like it's a repeated thing, then we need to see it. We need to check it out to see if there's something that we can do to manage that discomfort. Because usually if it's over and over and over stated, then there's a real problem there that we could possibly help alleviate. But then other than that, it's just okay. If they'll let you brush, do it. If they do it on their own, great. You're just going to have to monitor it. It's just like any other kind of bodily maintenance thing. Like you may have to help bathe them if they can't bathe themselves, or make sure that they bathe themselves adequately. Same thing with brushing teeth with all those tools. I think an electric toothbrush, if they can tolerate it, is great because it'll do all the work for you, and it's timed. Some of them sing to you. It can be a great experience. If you can get that routine established where they'll use that and they can know that that's coming, and it's something that we do every day after lunch or whatever, that can help minimize confusion and agitation as best as possible. But really, it's just if you can do it, do it. If you can't, that's okay too. It's going to be okay.
I remember you're saying you're talking about someone with dementia and how they present. I remember going to a seminar one time, and they were talking about dementia, people with dementia. And I remember that the presenter was talking about a woman that she had encountered that kept kind of patting her cheek and laughing, and just laughing hysterically. And it took them, this is someone who I believe, I can't remember whether she was at home or in a retirement community or memory care facility. But I remember that she was talking about that it took them the longest time to understand that the laughter that she could not communicate that her tooth was pain, but her patting her cheek was really the clue that they finally figured out, oh, there's something going on. And evidently the woman had a really awful infection. Tooth was really infected. So yeah, this whole dementia is so difficult, such a difficult journey.
It's so difficult for the people, the caregivers, the family. I mean, it is so very difficult.
Right. And you talked about which truly some days are good and some days are not good. If somebody has a dental appointment scheduled, and it is really not a good day for the patient, the person with dementia, how would you recommend they deal with that? Is that a time that it would be appropriate to call the dentist office and say, it's just not going to happen, let's reschedule? Or kind of conversely, is there a way that dental offices can kind of scoop someone in when there is dementia and when it's a good day and they need to have dental work?
Well, all I can speak for is my office. So if your loved one is having a very bad day, then absolutely don't bring them into the office for their sake. I mean, it's only going to compound confusion and irritation and possibly anger or, upset. We don't want people to, be upset at all. So for my office, I have zero problems at all. If you're a caregiver, your loved one is having a bad day, you need to cancel that appointment. No problem. And certainly we'll try to reschedule you for, and hopefully have a better day. As far as with our office, like if you know that there's a situation like that and you're like, okay, dad's having a great day today, is there anything available? We certainly welcome people to call, first thing that morning, and then we can try to work that in the schedule. I mean, we have a schedule for a reason, but things change, and certainly we want to see people that are having issues or problems or concerns or infections or anything, and we have built in kind of emergency times in there. So if miss the regular appointment, having a good day, I welcome people to call my office to, and I would think most offices would do that, to say, hey, we're having a great day. Is there any way we can get in there? And, and just accommodate as best you can.
Gotcha. Thank you. Because I know for people who are caring for someone with dementia, that it can be day to day and sometimes hour.
Absolutely. Absolutely.
Yeah. But that understanding really would be very helpful. Dr. Whitaker, we have talked about so many different things. Is there anything else that you feel like we really need to be sure to talk about?
I think really if you just focus on the big dial movers, and that's what we've talked about throughout the whole time, is consistent home care, consistent routine home care is a big dial mover. That's super important. Minimizing that sugar and processed food, and then getting the regular checkups if you can. Try to just make it a priority. If it's not every 6 months, if it's every 8 months, whatever, it's just so that we can hit big things off hit small things off before they become big things. That's always super helpful. Now, that doesn't mean that we'll always be able to fix them. I mean, I have several elderly patients, dementia or not, that just don't have the capacity to sit in the chair and get things fixed. So we have to kind of triage what needs to be done. And sure, it's essentially watching things deteriorate, but it's kind of a controlled demolition as opposed to, putting them through a bunch of hard things that if they can maintain for several years, and then we hit the things that are truly detrimental to their health and prioritize those, and then just leave the rest of it, to as it comes. That works too. You have to kind of meet people where they are, and honestly individualize each plan for each person. But really, just focusing on the big things, focusing on cleaning the teeth when you can, and not eating the junk. That's 80% of the battle.
So a lot of it that we can do on our own without intense dental intervention.
Yes.
When you're talking about some of your patients that really have difficulty and that you need to work with whatever they can do. I'm even thinking, arthritis can make it very uncomfortable to be in that chair or in that position, cranked back. People who have had bone loss and have lost teeth and now have dentures. that's a whole nother scenario.
Yeah, dentures are like prosthetic limbs. They work, but they're not the same as what you had. So dentures are extremely difficult to one initially get used to and adapt to, but then the older you get, if you have dentures, they're so difficult to utilize in any kind of efficient manner. So if you can keep teeth, keep them.
And when you're saying dentures, I'm thinking even implants. I have a friend whose mother clicks her teeth in.
That's phenomenal.
Particularly because she's 91, 92, something like that. Yeah.
That is a phenomenal option if your bone and health can support the implant placement procedure. That is like life changing for people that have dentures and partials and things like that. That implants are amazing and life changing for sure.
Right. This has been excellent. Thank you so very much for all the insight, all the tips, all the be sure to do 1, 2, and 3. Thank you. All of this. And thanks also for helping us understand the key role that dentists can play in our overall health, not just our oral health, but our health in general. So thank you for that.
Well, thanks for having me.
Absolutely. Thank you also to you, our listeners. We hope this information will be helpful to you and to your loved ones throughout your caregiver journey. We definitely want to thank Pace at Home in Hickory, North Carolina. They are the sponsor for all of our Caregiver Community podcasts, and we are indeed grateful for their support. This Caregiver Community podcast is part of the Mesh network of online shows and podcasts. We record one new ACAP podcast each month, addressing many of the topics related to caregiving and advocating for an older adult. You will find all of our podcasts on any platform where you listen to podcasts, as well as on our website, www.acapcommunity.org. While you're on our site, we hope you will take a few minutes to learn more about ACAP, our educational programs, and our local chapters. And if there are other topics you would like for us to address as a podcast, please do let us know. Again, that website is www.acapcommunity.org, and that's ACAP, like Adult Children of Aging Parents, acapcommunity.org. Thank you so much, Dr. Whitaker, for being with us. Thank you to you, our listeners, and to Pace at Home for sponsoring this. Stay well, everyone. Bye for now.